A lot of times people get diagnosed with diabetes not because of a blood test, or maybe they have not even followed up with their doctors in a long time, but maybe they develop a wound which is not healing
Okay.
properly, and that's when they find out that, oh, they had this diabetes which is going on for a long time.
Welcome to the Expand podcast, where we unlock the secrets of respiratory health for healthcare professionals. Join leading experts as we dive into chronic lung diseases and expand your practice.
I'd like to introduce for this podcast Dr. Jean. Dr. Jean is in practice in British Columbia. He's a clinical instructor in the Division of Endocrinology at the University of British Columbia, UBC. He's the first Canadian physician to be triple board certified by the American Board Endocrinology, Internal Medicine, and Obesity Medicine. Dr. Jean is specialized in the treatment of osteoporosis, managing bone health in individuals undergoing cancer treatment. He's also actively engaged in education through his patient education platform. And he discussed topics such as bone loss, prevention, diabetes, cardiovascular protection with clarity and expertise. He's the only Canadian to have won the AACE Rising Star in Endocrinology Award 2022 and to feature on the Medscape list of 25 top rising star of medicine in 2020. In 2022, he won the top 25 Canadian Immigrant Award. I'd like to welcome Dr. Ashay Jain, who is an endocrinologist, and we are going to discuss about this world of endocrinology, anything that it may have to do after with COVID-19. And as a patient, for some of you, as a clinician, or even as a researcher, what do we know and what we don't know, and what is the research leading us in the near future? Let's talk about you. How did you started in medicine and decided to go in this field of endocrinology?
It's a very interesting story, Dr. Barbo. I come from a family of doctors. My father is a family physician. He just retired last year after 51 years in practice.
Oh my God.
I've got two older sisters in medicine. Growing up, I did not want to be a doctor because I said that's so common in my family. But I was in grade 12 when my dad had to undergo a cabbage bypass surgery for the heart.
Wow.
And that's when I first got, exposed to the medical field and what it was working in the hospital and seeing, how all these doctors and healthcare providers were taking such good care of people coming in with various illnesses. And that's what was a life-changing experience for me. And I veered towards medicine after that. Specifically about endocrinology in med school, we would have rotations in rural India. So I was born and raised in India.
Yeah. Okay.
And we had some rotations in rural India. And that's where I saw the entire the burden of diabetes, where this is such a condition that if it's properly treated, no complications can occur, but it is also an asymptomatic condition. So people living with the condition often have no idea about what's going on because of diabetes in their body. And time and again, I saw so many people coming in with foot infections that required limb amputations. And
very the complication of it. Wow. It's a very insidious absolutely. That's kind of interesting. Hopefully your father didn't do that on purposes, that he can finally get you in medicine. Okay. But that it happened that way, that your father was sick and you started to be interested and did it for the right reason. The field of endocrinology is an interesting. We know the field very much through diabetes. But if you had to kind of demystifying the concept for the audience, and some people are more from the public and a patient, What would you say about endocrinology?
Yeah, so endocrinology is this fascinating part of medicine that deals specifically with hormones in the body. So when we talk about hormones, insulin is one of the hormones, which if it's
Hmm.
deficient in, we can lead to diabetes. But there are so many other different hormones. There's male hormones, female hormones, thyroid hormones, hormones in the bones that help regulate the bone mass, hormones in our pituitary gland that determine how tall we grow,
Mm.
what is the amount of sodium that we maintain in our blood. So, all these different hormones, it's this fascinating study of these hormones that is called endocrinology. In my mind, endocrinology or the study of hormones is something that could affect anyone from right from birth until they die. So at all age groups in all socioeconomic aspects as well. So it's something that is all encompassing.
That's interesting for people listening now. You can see that this is not endocrinology is not only about diabetes. It's about hormone, and hormone regulated so many things that it's such a large field. And through birth to up to the aging also, then we have a lot, okay, in terms of the lifestyle also that can impact on, and then some of this could lead into really a huge change, okay, such as obesity, such as diabetes, where we have type 1 and type 2. Can you talk a little bit more about that, and lifestyle, okay, on the some of these known endocrinology disease that you treat quite often in your practice?
Absolutely. So I'd like to give an analogy of a car, if I may. So when we are driving a car, we want to maintain a certain speed. And for maintaining that optimum speed, there has to be the right pressure on the gas pedal and
Yeah.
the right amount of pressure on the brakes, right? So if there's too much pressure on the gas pedal, the car goes too fast. And if it's too little, the car slows down. And also, how we take care of the car is very important. So that pressure on the gas pedal is essentially how our body regulates hormones. Too high is bad, too low is very bad as well. And what we do with maintenance of the car is essentially the lifestyle part where it makes a big difference as well. So
Mhm.
the gas pedal are the hormones in the body where the body tries to regulate it. But for that, the car needs to be in good shape. And that's where lifestyle plays a very crucial role in conditions like diabetes or obesity. Now, part of that is genetics. That's something we cannot change. So it's, the car that you buy from the manufacturer, you can't really change that once you're sitting in the car. But how you maintain that car, the modifiable factors. So whether somebody smokes or not, that makes a big difference. Whether somebody has healthier food or they eat a lot of junk food, that makes a big difference. Our sleep levels make a big difference. If
Mhm.
you're not sleeping well, that causes more inflammation in the body, that leads to more of these diabetes and obesity conditions occurring. How we regulate our stress levels, that makes a big
Mhm.
difference as well. So there's a whole bunch of modifiable and non-modifiable factors, and these play a very vital role in how our hormones regulate in the body.
That's kind of complicated. At the same time, having a good life mean of not necessarily always okay. You can have excess once in a while. The body can take it, but it's about, okay, having these excess all the time, okay, in our health habit, and that is going to have a huge influence, especially from an endocrinology point of view. When we're talking about COVID here, because that's also, we've been from years, okay, of pandemic. Now we're in more of an endemic, but we are to stay and live with COVID like we do with other respiratory viral and infection, okay. But we've been hit so hard with COVID that we're trying now to understand better what is the relationship, okay, of this infection with certain system, and such as the endocrinology system. What can you tell the people about what we know about the endocrine system and the COVID-19?
Great question, Dr. Barbo. So we know that the endocrine system plays a very vital role in our body's immunity and how our body heals itself. For instance, if we talk about something like diabetes, a lot of times people get diagnosed with diabetes not because of a blood test, or maybe they have not even followed up with their doctors in a long time, but maybe they develop a wound which is not healing
Okay.
properly, and that's when they find out that, oh, they had this diabetes which is going on for a long time. So we know that the endocrine system is very closely connected with the body's immunity, not just diabetes, but other conditions like adrenal hormone dysfunction, obesity. These can also weaken our immunity and our body's ability to heal, which in turn can often exacerbate the potential of acquiring COVID-19, as well as the
Mhm.
healing of the body following an infection.
And there's been a certain disease, that are known now associated into complication of COVID that lead into hospitalization, more severe disease. And unfortunately, some people have died from COVID, and there's still people, even we're in an endemic at this time of the year, we see in the hospital people admitted with COVID. But very often we hear about age. Oh, sure, aging population. Older you are, then higher the risk of complication. But there are certain comorbidity also. Again, those comorbidity um, can be of all sort. Okay, we often hear about patients that have immunodeficiency, cancer, respiratory disease, cardiac disease. But what is it about people that have endocrine disease that could be at risk of complication with COVID-19?
So that's a really important concept. I'm going to answer that in two parts. So the first part, when we look at the actual COVID virus itself, right, when we've done molecular analysis of the SARS-CoV-2 virus, we know that the S spike protein that
Okay.
allows the virus to attach to the cells in the body. And the cells in the body need to have a receptor called the ACE2 receptor.
Mm-hmm.
Now, as we know, the ACE2 receptors are found abundantly in the lungs, and hence that's why COVID-19 often causes symptoms related to our respiratory function. But these ACE2 receptors are also found in endocrine tissues, such as in the brain. There is a gland called the hypothalamus gland, another gland called the pituitary
Okay.
gland. We see ACE2 receptors in our thyroid gland, in the testicles of males, in the insulin producing islets of the
Wow.
pancreas. So we know that a lot of individuals, when they get COVID-19 infection, they may have downstream effects on a lot of these hormone producing parts of the body. And that can lead to conditions like increased incidence of diabetes, pituitary gland dysfunction, thyroid problems, a whole bunch of things. So that's one part of this. A second important part of this aspect is condition like diabetes or obesity. These are called the mother of all conditions, chronic conditions, because we know that diabetes is not just a problem of abnormal blood glucose. But what this abnormal blood glucose does is it causes damage to the tiny blood vessels in the body, such as those in the eyes and in the kidneys and the nerve endings, as well as some of the bigger blood vessels, such as in the heart or in the brain. Now, when these blood vessels get affected, we are at increased risk of developing heart attacks, strokes. A lot of times, so I work at Surrey Memorial Hospital here in BC, and we see a lot of individuals who come into the hospital with a stroke or heart attack, and they didn't even know that they had diabetes. We
Wow.
get diagnosed at the time when they come in, and it's probably these high blood sugars that led to heart attacks and strokes as one of the possible complicating factors. Now, we know that when an individual gets COVID-19 infection, especially if they have other comorbidities or other medical conditions, such as having a heart problem or previous history of stroke, then unfortunately, these individuals have worse outcomes and they are more likely to require intubation. So, from that perspective as well, diabetes and obesity have often been associated with increased burden of the
Wow.
COVID-19 infection.
Then it's interesting because the way that people have to see that is that we're often thinking about the infection in people that have comorbidity. And the comorbidity here that have been mentioned quite often and data are really evidence-based here. It's diabetes and obesity. But we're talking that these two comorbidity are also given complication of other target organ, such as increasing cardiovascular disease, increasing stroke, increasing kidney disease. And those diseases are also comorbidity that increase the risk of complication of COVID. They're making the COVID more severe, that can result in an hospitalization or death. But also, you can have dysregulation in certain endocrine organ, because of this ACE2 receptor, and that could also be a consequence. We're not talking very often about this as a complication. Do we know if these complication that you're talking about can remain after, again, could be part of the, even when we're talking of the long COVID, will there any of that that could be part of the long COVID?
Absolutely. So we are still uncovering a lot of these ramifications of COVID as time progresses. We know that studies in the United States and Germany have shown that the risk of developing diabetes is about 46% higher in those who have had COVID-19 versus those who have not been infected. The one theory for this is because COVID causes a lot of inflammation in the body, which leads to insulin resistance. Essentially, what it means is the pancreas needs to churn out a lot more insulin to do the same amount of work, thereby leading to burnout of the pancreas. So that could be one of the reasons. Another reason could be a lot of individuals who say have had a bad COVID-19 infection. Part of the treatment could have involved steroid treatment, and steroids can often lead to sugar elevation, which down the line can also cause burden on the pancreas, leading to diabetes. So I think we are still uncovering a lot of these aspects. We know that thyroid dysfunction can occur right following after a COVID-19 infection, and sometimes these individuals may develop a prolonged hypothyroidism or an underactive thyroid as a part of long COVID complication.
This is important for people to remember that it is complicated when you get COVID, and we shouldn't only look at the complication of COVID as it's been described during the pandemic, with hospitalization for the more severe and death for even the more severe. That there is a lot of consequence, and even some of these chronic diseases are a risk factor for getting the COVID complication when you have the COVID, but they can also be induced for people that have COVID. And the best way of preventing COVID, what do we know about what should be done to prevent this for happening?
Yeah, so I think it's important that we look at it both as a proactive approach and also have a component of a reactive approach. So proactive approach obviously means taking adequate precautions so that we can prevent getting the infection in the first place. So especially those people who are at a higher risk, such as those with extremes of age, those who have other comorbidities, they are the highest risk individuals. But I think these basic precautions are something that all of us should incorporate. The most important aspect of that is making sure that our vaccination status is up to date. We are recording this here in November, and a lot of people in November 2023 feel that we are past COVID. It was a thing of the past. Both you and I know, Dr. Burbo, we work in the hospitals and we see people coming time and again with this infection still. It's something that's going to be part of our lives moving forward, whether we like it or not. So Vaccination is very important. Basic precautions that were especially well entrenched during the pandemic height, which is, hand washing, making sure that we are preventing, close contact. These things should, I believe, still continue. So these are some of the more proactive approaches. But even at a reactive approach, say somebody already has diabetes, these individuals continue to be at a high risk of developing infection. So it's important, obviously, that their vaccination status is up to date, not just for COVID, but I think other respiratory
Yeah.
conditions as well. So, a condition called respiratory syncytial virus infection, or RSV infection, is very common in people with diabetes, and that leads to more heart attacks and strokes. There is now vaccination available for that in Canada, so I think it's important to consider that. Um, we also need to make sure that people with diabetes are taking better care of their sugar, so that even if they do get infected, then their immunity is still not affected by high sugars, and their ability to heal is still good. So I think these are various aspects that we need to consider, both preventatively as well as moving forwards for those who already have endocrine conditions.
This is going to be very useful, and we hope a lot of patients with diabetes have the problem of obesity would listen to you and your podcast. I would certainly refer also people to talk to their physician. But it is important to work on many aspects. People have to realize vaccination has an important role. It's done much more good than any damage that we can hear. But there are also, beyond vaccination, a lot of precaution that had to be taken. And as you said, making sure that your diabetes is well under control is kind of also number one rule. Do we know any condition about long COVID that had been more in certain patients that have endocrine disease, such as obese or diabetes? Because that's now what we're dealing with. It's the concept when you have the COVID. Now there are consequences, and one condition called long COVID.
Yeah, absolutely. So perhaps the single most condition that has been associated with long COVID is obesity. We do know that individuals with obesity, unfortunately, when they get COVID-19, the outcomes have been worse. And obesity is one of those conditions which can affect every single part of the body. We often feel that it is just excess weight, but that's not the case. Obesity is a condition where there is chronic inflammation occurring in the body. So basically, if someone is living with obesity, the inflammation in their blood is always at a slightly higher level.
Okay.
So think about it as choppy waters in the ocean, right? These waters are never still or calm like that in a pool. And then when you throw this huge rock of COVID-19 into those choppy waters, then it's like this whole tsunami of inflammation that can occur. And that has far reaching effects. So people with obesity are more likely to develop respiratory issues down the line, heart issues down the line, future infections as well. And that's why it's really important that if somebody has obesity, we look at them achieving a healthier body weight or decreasing their excess fat tissue, so that we can help reduce that inflammation burden in the body.
That's interesting. What is for people that want to have more information about obviously their condition, but also about COVID and in general, but also more specific to certain comorbidity. Is there any place? What would you recommend? Okay, that people could, other than listening to this podcast, okay, but then people can just go into a platform that is reliable, okay, not Mr. Google, in general, okay, that would be helpful for them.
Yeah, there's tons of very good resources, Dr. Borbo. I'm just going to list off some of the
Oh,
ones that I
please,
know, and I
yes.
would love to, get some more resources from you as well. So when we talk about vaccination, I think some of the best, resources available are on the NACI website. So that's the Canadian version of CDC. That's our National Advisory Committee on Immunization. And this has both resources for healthcare providers as well as for the general public. From an endocrine perspective, Diabetes Canada has some excellent resources.
Okay.
Obesity Canada website also has some very good resources regarding the basics of care of these endocrine conditions. I do have a patient facing education platform. It's called drakshayjain.com. And I do YouTube videos as well as on Instagram. So on YouTube, it's Akshay Jain, and on Instagram, it's Akshay Jain Endo. Where I try to put out things about COVID and other endocrine conditions from time to time. So those can be checked out as well. Are there any resources you would suggest, Dr. Borbo?
No, that's just fantastic. Sure, we have Respi Plus has living well with COVID, and that's another area. It's not specific to the endocrine system and the diabetes, but I like very much, and what people can get to these resources. I'm sure if they Google your name, that's one thing that Google is useful. It's Googling the right name or Googling the right institution. Then from there, okay, I think the resource you've been mentioning are quite important resource. It's important that people get to the right healthcare professional and institution, that they receive the right and information. This is not about propaganda for or against. It's about providing the right data, the right information, and then for people to be able to decide from this information what they want to do, or to bring that information into discussion with another healthcare professional or a physician, that's someone that they trust, that they can discuss again. And this is how for certain people, it's clear from the beginning. For other people, it takes more time, but at the end, it becomes a real shared decision where people are well informed, where they decide to take a decision about something. What would you be your last message if you had to say, either in terms of research in the endocrine system and COVID, or in terms of practice that you would like to deliver to people that are listening to this podcast?
I think the most important thing to note is that COVID is not history yet. It's actually going to be part of our present and will continue to be part of our future as well. The virus caught us unawares when we first got exposed to it, and hence we saw the amount of damage that it could do. But now we are hopefully wiser. And it's important that we take our learnings and continue to incorporate that in our lives moving forward. So all of us, whether we have medical conditions ourselves and are at risk of getting the virus and having a bad outcome, or if we are living with people or knowing people in our basic circle who could be exposed to this and have bad outcomes, it's really important that we take basic precautions. We have been through some very bad years with the pandemic, and I really hope that we never get something like this again, and it all falls down on us. So I think it's very crucial that we continue to take the latest vaccine recommendations and do basic care so that we prevent such a situation from occurring again.
I'd really like to thank you again, Dr. Akshay Jain, and Endocrinology, UBC. This is quite important, again, for people to realize, and people who wants to know more, they can just access to your platform and other platform that are available that you have mentioned, and giving the perspective that there's lesson learned, again, as knowledge we have now, we can do something. And as time goes, there's going to be new knowledge. And then obviously we hope to be able to do more in terms of prevention and in terms of people who still have the disease or complication of COVID-19 and or people that have endocrine disease. Thank you very much, Oki, for your time.
Thanks for having me on your channel. Take care.
Thanks for listening to the Expand podcast. Stay tuned and listen to other episodes on chroniclungdiseases.com/podcast.